Let's stand for our invocation. Father, thank you for this day. I just hope that you find favor with everything we say and do as we begin these series of meetings today. May we be ever knowledgeable about your presence with us at all times. Thank you again for this day and our safe travels getting here in Jesus' name. Amen. Shelley, roll call, please.
Yes, sir. Mike Dobbins.
Here.
Dora Petskowski. Here. Sasha Black Fox Claus. Here. Danny Callison. Here. Julia Coates. Here. Joe Deere. Kevin Easley. Here. Lisa Hall. Here. Johnny Kidwell. Here. Darrell Legg. Here. Cody Poindexter. Joshua Sam. Here. Mike Shambaugh. Here. Melvina Shotpouch. E.O. Smith. Here. Condessa Teehee. Victoria Vasquez. We have a quorum.
Thank you, Shelley. On to reports. Well, before we do that, let's approve the minutes. If you've had a chance to look at those, I'd entertain a motion to approve the minutes. Okay. All in favor? Aye. Any opposed? On to reports from the Claremore Service Unit, Mr. George Vallier. Welcome, George.
You have my monthly report there in your packet. I wanted to give you an update. Last week, we tested, we had 150 COVID tests, 48 of those positive, 32% positivity rate. We have 0 admissions for COVID for this. So we've been, that's kind of picking up there at Claremore. I wanted to point out on the dental side, we're down, the report that I've got says we were down 7 dental assistants, 7 out of 14. But we had 1 in new employee orientation when I left this morning, so we're making progress. As far as staffing, dental, we have 6 dentists out of 6 positions. Assistants, we have 7 out of 14. And hygienists, we have 2 out of 2. That's what we're allocated there. Any questions?
Questions for George? Are there any other areas where you're having staffing challenges?
That's the most prominent. That's the one we're really focusing on.
Still dental assistants?
Yes.
Okay. Okay, George.
Thank you.
Thank you. Dr. Stephen Jones from Cherokee Nation Health Services.
Good afternoon.
Thank you.
I think you'll find my report in your packet there. A few highlights that I want to kind of point out in the packet. Let me get my thing opened here. You'll notice that our inpatient numbers are continuing to grow and our hospital's staying full more than it's not. A lot of that's due to our partnerships and our expansion of services and being able to keep people closer to home, which is part of our mission. So just want to recognize that that's happening over this last year. That's just continually building. So as we get closer to the opening of that new hospital, we're already hitting capacity numbers. So we're ready to get that thing online as soon as we can. And thank you, all those of you that showed up for our topping out ceremony. That was a nice little ceremony we had there. In the report, you'll notice our vacancy rate dropped a little bit. That's attributed to, number one, we've got some dedicated staff in HR now that's dedicated to health. They're helping us. We're also seeing a stabilization in the workforce market as we're getting further away from COVID, where we had areas where workforce had either retired, decided not to come back, or they started going into traveling capacity. So everything's starting to stabilize there, and we're starting to see that here in our own system. And generally across the board, Cherokee Nation's a great place to work. People are realizing that and coming to work for us. So we've got a lot more interest than we've ever had of people wanting to come. And when we put out feelers or recruitment for providers and some of our different service lines, it seems like there's more and more applicants. And that's due to our residencies too. We're creating that pipeline where we're seeing those return on investment starting to happen. Just like our last graduating class of residents, family practice residents, there were 6, and we retained 5 of them. So that's a tribute to how much they liked working in our system during their residency, if they wanted to stay with us. So that's a great thing. Visits across the board are continuing to increase. If you look across the report, almost every system, every one of our health centers has an increase in visits. So again, that just shows the great job we're doing. People are choosing to come to us. We really don't know what the capacity is there, is how many people out there are looking for health care, but it shows that we're being one of those that are chosen to, people are making that choice to come to us. A couple of highlights I want to talk about. Hospital Week was back in May, and at that time if you remember, I told you we celebrated our hospital and those employees that work in the hospital. Well, this last week was Health Clinic Week. So we celebrated all of our clinics and had many activities. We had recognition of departments. We had door prizes. Some of our clinics decided to turn this, or they had theme days too. They all really got into that. When you see the Healthy newsletter, you'll get to see pictures from that. We'll publish those in that Healthy newsletter that you'll get. Some of the clinics, CNOC and Stillwell, both decided to make it use of that time and that camaraderie to do something for the community. So they chose a charity or a foundation that they could work with in the community to help support. Wilma P. supported the school backpack program. And my understanding is they collected about 2,300 items for that backpack program. And then CNOC did some stuff to raise money for Special Olympics. So I want to give them some special credit because they were a little creative and took a good thing and turned it into a community thing. So I'm really proud of them for doing that. That wasn't something we required. They did that on their own, and just want to acknowledge that. And like I said, when the Healthy newsletter comes out, pay attention to that. You'll see some funny photos and good pics from that week. So that ends the part I want to talk to you about. If any questions, I'd be glad to answer them.
Anyone have questions for Dr. Jones? Candace?
I don't have a question that I want to ask in this forum, but I do have something I'd like to visit with you about immediately after, if you can hang around for just a minute.
Absolutely.
All right, thank you.
Yeah. Go ahead.
Thank you. Dr. Jones, are we still utilizing adaptive workforce?
We are.
In preparation with budget hearings coming up, do you have an idea of how many contracts that we currently have?
I'm sure they'll be listed in the budget and what we have as far as budgeted for that. Those are very short-term contracts. We've limited those to 3 months. Anything that goes over 3 months has to be approved. To extend it longer than that, it's usually just to fill short-term needs. We've reduced that, and we have an initiative within all of our clinics after COVID to start reducing that and start recruiting heavily. That was a little bit, and that's what I wanted to point out, our vacancy rate. In the last 2 months, we've had dedicated HR staff that's dedicated to health now, so we have seen some progress in that area. Recruitment in the healthcare field's a little more difficult than just setting up a job fair somewhere. It's a lot more going out to the schools, going out to the nursing schools, going out to the professional schools, and making them aware that we're here. So there's been a lot more organized effort to get those vacancies filled through recruitment rather than just waiting for someone to find us.
Okay, thank you.
Julia?
Hi, Dr. Jones.
Hi there.
I was wondering, do we test for syphilis as kind of a routine thing when people come in for labs? And
We have a consent form that someone can choose not to be, but it is part of our consent form to do that. It's part of our initiative to do contact tracing, and that's a national initiative throughout the public health, and maybe Lisa can speak a little bit more to that, but we are participating in that. Mm-hmm. Our ID clinic is participating in that, and we're doing everything we can to help eradicate it.
so the consent form is to opt out.
You have the ability to opt out if you, when you fill out your paperwork, if you choose to do that.
But you don't have to sign something to actually give consent to do it.
When you sign your consent, it's part of that consent form that you sign, just like the other things that we test for and screen for also. it is part of the consent paperwork that the patient is giving us consent to screen for.
Okay. I'd be interested in seeing that form. Do you have any knowledge of situations where people, I mean, how visible, I guess, is the question I'm asking about, the things that people are consenting to? I imagine it may be just a list of things in little boxes or to check.
Well, it's a legal form that's approved through legal to give to patients, and, patients should read it before they sign it. So as far as I'm concerned, I mean, we're doing everything by the law and by the way we're supposed to do it. I've had no feedback in any capacity that there's been a problem with that at all. So if there is some
Well,
feedback, then I'd be glad to.
There's some feedback.
Yeah.
That's why I'm asking, because I'm wanting to understand. How long is the legal form? A couple of pages? Or?
I couldn't tell you off the top of my head.
Yeah.
Yeah.
Does
But it's
anyone-
not
does-
something that we hide. It's something that's every patient is presented with, and
Yeah.
annually they're required to fill out all those forms again. We get a lot of feedback from that, patients not wanting to fill out the forms
Right.
again, but that is something we annually require all of our patients to do.
I know sometimes when I, go for not just medical services, but anything where I've got to sign legal forms, there may be someone there oftentimes that basically puts it in plain English for me, as to what this form is saying. Do you know if we do anything like that for people? Because
I'm sure if someone asks a question, we'd be glad to answer it, but ultimately it's the responsibility of the patient to give consent or not give consent for treatment for what we're doing. We don't do treatment without consent of the patient. So if there's someone that has a communication issue, yes, we do provide that. And they have the opportunity to visit with someone if they ask for that.
I understand the onus is on the patient, but I still think that we know our population, and that whether we're legally liable or not, it would be something considerate and good for us to do, to actually sit down with people and make sure that they do understand what they're signing here, because this is, I do have something from someone who was quite surprised when her lab results came in to see that she had been tested for this, and this is an educated person who can presumably read legal forms, and yet it went right by her. So I don't think that it's as obvious to people, legal forms never are, it seems like, as those who deal with them on a routine basis might think. So I'll just suggest that.
Okay.
Thank
Thank
you.
you for your suggestion.
Sasha?
Thank you. Is this something that you can pull up on Power DMS to show us the consent forms?
I'm sure they're in Power DMS, yes.
Do you have that on your phone, on the app, or?
I do not.
Okay.
Johnny?
Hey, Dr. Jones, thanks for coming in here today. The consent form that Councilwoman Dr. Coates was talking about, could you send us a copy of that, please?
Yeah, absolutely.
Thank you, sir.
As a matter of fact, we're getting ready to launch an online service called Tonic that will allow patients to fill out their forms from remotely rather than just doing it, coming in and doing the paperwork, and those will all be posted online.
Giving them a little bit more time to digest it as well. That's
Well,
good.
also allow them to save time. If it's time to annually renew those forms, they have an opportunity to do that before they come to the appointment. If they're pre-registering for something, it gives them an opportunity to do that before they come to the appointment. So we're getting ready to launch that soon. It's not quite ready to hit we're still in the pilot phase of it, but that'll be something that's going to be available to all patients, which should speed up the process a little bit for patients and have it a little bit more at their convenience rather than having to wait for someone who's in the window to finish before they can come up to the window. And there's going to be kiosks available too at our health centers for them to use.
Well, sounds good. Appreciate it. Thank you.
Sure.
Junior?
I really enjoyed the other day at the beam setting. That was pretty good thing. Have they revised the completion date? Have they changed
The
it?
completion date originally is in October of 25. That's when substantial completion is supposed to be. That's always fluid because of weather and things of that nature, lead times on things. Our Our occupancy date we have on our calendar is in January or February of '26. So we're still working in that time frame. We don't have it nailed down specifically yet.
Are our contractors, are they incentivized to finish by a certain date? They get
I believe
monetary?
there are incentives and penalties associated with that project, yes.
Okay. Anything else for Dr. Jones? Okay, thank you, Doctor.
All right, thank you.
Ms. Pivek, Lisa Pivek from Public Health. By the way, that was quite a report, Lisa.
Good afternoon. I was going to say, you have our lengthy report in front of you, and I don't have a great deal to highlight today. As many of you can see through the report, we're pretty busy. We're finishing up the last bit of SEBT with over 100,000 children served, starting to move into the fall projects. This is when a lot of our outdoor programs, our walking and running clubs get really popular. You can see there's more wings races in October than any month. So our school projects start in August, so moving on to those things. But other than that, if there's anything in the report that I can answer or go back and get an answer for, please let me know.
Melvina?
Lisa, on like community buildings or centers, anything Cherokee Nation, is there, can they smoke on the facility? I mean, can they smoke there?
If it's a Cherokee Nation property, no.
Okay.
No tobacco use.
That's what I thought.
Commercial tobacco use
I went to a
traditionally is
place,
allowed.
it's a community building, and it was, somebody had rented to have an activity there, and all the smokers were sitting right in front at a table, and doing that, and I thought, ew, I don't think.
Yes, I can, while policies are in place, sometimes it's hard to, interject
But I
into
did
those.
see no sign to say
Now,
that.
which community building was this?
In one of Kenwood.
Kenwood, okay. At the new one?
New one, mhm.
Oh, absolutely should not be there. We're probably actually waiting still on signs since it's a new building
Yeah.
to get those put in, but absolutely no smoking there. I'll pass that on.
It was
Sure.
right in front of the senior.
Senior, where the seniors would go in?
Mhm.
Okay. Oh, yeah, I better. Thanks
Thank
for
you.
that.
Uh-huh.
Daryl?
Hey, Lisa.
Hi.
On the Marble City portion of your report, I was there July 9th for that walking and balance presentation. I'll tell you what, we have a state-of-the-art, just such a well-written program. I don't want to brag on it, but, we had 250 plates, and we went through every plate and had to go get more plates, and the report says 200, so I know there's probably 300, 350 people there. It was such a long line. And anyway, I just want to brag on that bunch because, man, they're doing it's so received, the program is by every community they go to. And I don't know, it's just, I'm so glad and thankful that we have that.
All right, thank you. I'll pass that on. Appreciate that.
Lisa?
I just wanted to let you know, Saturday morning, I attended the Tahlequah Farmers Market. It was a record, 1,100 people at the farmers market.
Wonderful.
Amanda Abel and Vicki King was there
Mm-hmm.
handing out the bags and the jump ropes for the kids and the cups and everything, and I assisted handing those bags. It was really nice. We had some participants come by that had questions about their cards or what they could do as far as spending the money on their cards and stuff. And I just want to say what a wonderful program that is for our participants. And just, they do a really good job answering their questions and everything.
Yeah,
I enjoyed it.
That farmer's market program is great. The
Yes.
staffing from WIC have done an amazing job. I was just looking, they have increased the farmers quite a bit this year too, up about 30, 40 farmers. So,
Mm-hmm. Yeah.
Thanks.
Yes, thank you.
Thank you.
Sasha?
As you were speaking of the walking and running groups, I just wanted to put a bug in your ear. I've been approached quite a bit in the past week about if we were going to have another walking group in Hulbert at the city park. So kind of keep
Okay.
that in mind if that's something that could be possible. I know the community would really enjoy that.
Absolutely. I'll pass that on.
Thank you.
Melissa?
Well, good afternoon. It's always a pleasure to see you, Lisa.
You as well.
So, In the questions about the syphilis screening, it was noted by Dr. Jones that this was part of a larger public health initiative. And I was wondering if you would kind of speak to the need for syphilis screening and why that may be a public health concern.
Right, and I can talk a little bit to it. Now, our role in it, we're partnering with health. Our role will be more of a contact tracing case investigation role with public health nursing. And we're actually still setting up that role, and that role will be to follow up with patients who are either lost to follow-up or we need to investigate further, look at clusters in community. We already, for some time, have been doing the surveillance. If you look in the report, our teams have been doing surveillance on syphilis for a while, and it's extremely important for us to make sure that we get as many people screened as we can so that we can stop the spread in communities. If you'll look across the nation, unfortunately, within our reservation, it's not quite as high as some of the other reservations across the United States. And it really isn't just the reservations, it's really broadly across the United States, an increase in syphilis infections. And those have severe consequences in the future for the children, potential for children that need to be born, on down the road for all kinds of things. This can be treated very easily, but we have to identify who it is and we have to identify the spread, and that's not exactly as easy as you might assume. It's not the same as COVID, it's just calling up, but it requires a specialized staff to do that, and that's what we're working on right now, is making sure that we have the trained staff that can call in sensitive situations, and more importantly, identify those clusters in communities.
Right. So, and the part of the reason why this is so important, you mentioned treatment is available if it's caught early. But
Correct.
if it progresses to some of the later stages, it can have extremely negative health impacts, to my understanding.
Yeah, absolutely. That's something I'd have to have Dr. Gann, I don't want to get too much into
Right.
his arena, but absolutely ill health effects down the road. And so that's why it's so important. Health does a great job of identifying, and this is a good partnership for us to pull in together with health and try to help them stop the spread. I think one of the biggest things is maybe identifying those cluster areas if we have them. And then using a gentle hand on how you do that, how you figure out, what to do in those particular communities to be sensitive to the issues.
Well, and I understand that screening itself can be a very sensitive issue as well, especially when, there are so many different factors involved that may increase an individual's risk. And oftentimes there may be situations where an individual doesn't know they're at risk.
Absolutely.
Because of, their relationship with a partner who may be engaging in activities they're not aware of, right? And so,
Correct.
so absolutely you need trained staff, and so I do know that this is a serious public health concern.
Yes, it is.
And it is very likely that it is not only syphilis that's
Correct.
being screened for, that there may be other illnesses that are screened for as well, including bloodborne pathogens like hepatitis C and things like that. So I know there's a lot to think about here, and I just kind of wanted to highlight the fact that, the screening that takes place within our medical facilities, it is for the good of the patient, but it's also for the good of our community. And thank you very much for your
Yeah,
time.
absolutely, because it's something that we have to work together to solve, because the solutions are complex, but identifying, and that takes both us and health services to really figure out where and when and how to combat that. But it is a very serious issue, correct?
Yeah, all right. Well, thank you for the time, Chair.
Anyone else? Lisa, I assume HIV is still prevalent. I guess it's a good thing we don't hear about it here in health. I'm not sure the last time we heard about
HIV infections.
Problem, so to speak.
Well, I think that highlights what Counselor Teehee was speaking
Yeah.
to, is that screening can identify the potential if you are at risk and find out you are at risk for one sexually
Yeah.
transmitted infection. There's great possibility you could be at risk for others as well. And I can't update you on HIV statistics specifically, but just letting you know that all of that is part of what goes on when you look at those with STIs. Yeah.
Could you briefly describe the difference between commercial tobacco and traditional tobacco?
Yes, I can do that. This is a term that personally is hard for me a little bit, and I talk about it with our staff too, because for me, Commercial tobacco use is just the general abuse of tobacco, like cigarette smoking, dipping, all of those other things that are not used in the fashion of what we might use them traditionally for. And I've always said that it's hard for everyone to really understand what we mean by that, because if you're using it traditionally, you already know you're using it traditionally. So nobody needs to tell you that that's what you're doing. But it's really the terms are really out there for folks who may not understand there's two uses of tobacco. There is commercial use of tobacco, which is not the same as traditional use. So by saying traditional use, we're really not educating the folks who are using it traditionally, we're educating folks that don't understand the use of tobacco traditionally, which might be used for a variety of things, many of which we don't necessarily talk about or discuss in public, but those are things that if you're using it traditionally, you know, and you know, though, that if you're, someone's sitting outside the building just smoking over and over, that's not traditional use.
So is traditional tobacco, is it readily available, like retail?
Not retail, I would not think so, but I mean, there are people who grow their own, I'm sure. Now, people do use, that's the other piece of it, people do buy tobacco to use in a traditional manner as well. It's more about the use of the tobacco and what goes along with that when you're using the tobacco more than it is necessarily just the actual tobacco that you use. Now, if there's more readily available, I'm sure that it's out there. I can promise you, I don't know where it all is, and probably most of it, there's probably a reason for that, because we just kind of like our plants and the things that we use traditionally, maybe not necessarily out there in the public for people to know.
I see no more questions. Thank you, Lisa.
Thank you.
Old business, none pending. New business, none pending. Announcements, the next meeting is tentatively scheduled for Monday, September 16th at 1 p.m. Need one more motion. We are adjourned.